Hello, Julia Maggio. Welcome, welcome. High Maintenance 12. Hello, Bacon Buns. There you go. High Maintenance 12. There's a couple of high maintenance. Kimberly Skiller, Chelsea, welcome. Welcome, folks on Facebook Live and YouTube. Welcome, Midnight Peace. Good to see you. Today's wide open in search of the Stork. Questions. You have questions, we have answers. So, hello, Zolorana. Hello, Linda. Emily Wad. Good to see you. Mrs. Shunibu. Welcome, welcome. Up. We got a bunch of people on the Facebook Live and YouTube. Please say hi so I know that I can get your comments. So, I'll say hi first, and then you guys say hi. Here we go. We say hi. Super Freshy, good to see you. Latoya Lawton, Silibanya, hello. Again, Mrs. Shunibu, good to see you. I don't know how you say that. X-O-L-E-I-Z. I got my kisses. Thank you. New beginnings. Super Freshy, hi again. Sarah Lou. Lou, there you go. You two envy me. You two envy me. Okay. Welcome everyone. There we are on this side. Caroline, Amy, Jordan, Lauren, Taniha, Lauren again, Ashley, Sarah, Erin. Oops, Kissy. Love kissy faces here. Okay. Just saw a baby's heartbeat last week, Zolarana. Oh, I'm so happy for you. Endless thanks. We definitely appreciate you guys. Okay, so today I'll say hi to people as I go by, but today it's all about you. It's all about your questions. Let's see what's happening. Colorado is just booming. We're so blessed. Hi from Boston. Hi from Spokane. I love it. Telling me where you're from. We have a new doctor that may be joining us in September. So we'll have Dr. Magarelli, Dr. Fink, and fingers crossed, we have another doctor joining us in September, so fingers crossed. We've added another 4 medical assistants, another 3 nurses. We're adding another embryologist, so we are expanding the number of patients that we're going to be able to see, and also the number of retrievals. So anybody west of the Mississippi, we are here, and the bandwidth is growing. Our downstairs has been expanded. We have another dozen offices. So we are so excited on how things are going. And see you in early September, fingers crossed, for Chiromo. And we have our first appointment virtually, Leslie, in October. Excited. So we are so excited. And also, from what I heard, the mid part of August, we are opening up our Sarasota office. So all you Floridaites, wonderful people, we're opening up, it's going to be basic stuff. We're not going to be doing retrievals and transfers yet, but boy, that's going up. Hello, Amaryllis, good to see you. Okay, so let's get to some questions. So yeah, I answered the question for Sarasota. It's going to be open, we think the 2nd or 3rd week of August, we'll begin to start seeing patients. We already got the teams hired. Training is going on. August, yes, August. But now they're not doing retrievals there, okay? What was the name of the acupuncture protocol before IVF? It's called the CMAP protocol, SMAP. That stands for Credenda Magarelli Acupuncture Protocol, CMAP. If you have any questions about that, go to eastwindsacupuncture.com, Dr. Credenda, Dr. King. They're the ones who are doing all of that. How long do you let stims go? Well, let's just talk about the IVF stimulation. Slow down the questions for just a second so I don't lose them. So the question about stimulation is, how long do you take your fertility drugs before you have to take the eggs out? Well, that's an interesting question. Typically, the average number of days of stimulation is 11 days of stimulation. Then you get your trigger, and then 2 days later, you get your eggs out. Okay, so that would be 13 days before you get your eggs out, starting at your baseline scan. Some folks, though, can get to a mean diameter, and last week we talked a lot about mean diameters of follicles. You want to get your mean diameter around 17, 18, 19, 20. You want at least 50% at about 17, 18, 19, 20 of all the follicles you have. So don't count those teeny weeny ones. You want to count the dominant follicles, 17, 18, 19, 20. So you want to have about half of the follicles, at least that size, when you should expect to get triggered, okay? So that typically takes 8 days. Sometimes it can take, 11 days. Sometimes it can take 8 days, and usually you're over 35 or certainly over 40, where we have what's called desynchronous cycles, and sometimes you have to balance how many eggs versus how many eggs that are too old, how many eggs are too young or immature. Sometimes, though, in Europe they do this, you can stimulate for 15 days, and it's called a low, slow protocol to help folks with PCOS, not hyperstim, but at the same time, try to get as many eggs. So the answer to the questions, how many days you stim, vary. So that was an Instagram one. Let's do a Facebook one. So usually how much later after baseline do you do transfer if you do the process without, oh, wait a second. So usually, so currently, okay, well, too much. Okay, too fast. All righty. Usually how much later after baselines do you transfer? That's 17 days. If you do the process without a cycle, a menstrual cycle, it doesn't matter. I asked because I ovulated and I had to cancel my FET and was told I can redo baselines and attempted FET without a period. Yes, you can. Sometimes you do break through. That's why I do not recommend personally these natural frozen embryo transfers. It's just too hard to do that. Michaela, hi Michaela, nice to see you. Over here, I had a successful, super freshie. I had a successful transfer with your office in May, but sadly miscarried, sorry. Should I keep the same protocol next transfer since it worked? Well, yes and no. The goal, super freshie, is to have a baby. So let us at least look at your immune level 1, 2, 3, 4. Let's look at whether or not you're doing acupuncture, because that certainly reduces miscarriage rates. Let's look at how you're eating, smoking, that kind of stuff. But no, let us take a look at it. Over here, when do you find out if you can do a fresh or have to do a frozen? Usually on the time of trigger. This is Sarah. If your estrogen is above 3,000 at the time of trigger, or your progesterone is above 1.5, then that's a frozen cycle, okay? Why? 2 reasons. One, hyperstimulation. The other one is poor outcomes. So don't put embryos into a uterus that has been overexposed to progesterone, like at 1.6, 1.7. It's just the timing is off. How do we get the info for the Sarasota office? Expect in about 2 weeks, you're going to be seeing actually on our website the 2 office locations. We're also opening up in Philadelphia. I just found that out, so that's kind of cool. Okay, so let me jump over here. Can you do payments? There is a $250 additional fee for every 6 months. Okay, Fataromo, I don't know anything about the financial side. All of that stuff is on the website. I don't really talk about this. Is more medically oriented, so that's where you'll find that information. All right, Kimberly, welcome. We're looking forward to you. How do you feel about reversatol? Well, I don't have any feelings. I don't do feelings. I don't think there's any data about its impact. I haven't read any data about it, so I really, LMA, don't know. Dr. Magarelli, does your office do abdominal retrievals in Colorado? We have, but those are at the last resort. Those are not the first option. But if we have to, we'll get those eggs. Will Sarasota do laparoscopy? I know nothing about Sarasota yet, Sarah, so I have to hold on there. Hello, Erlinda. I have antiphospholipid antibody syndrome. Is there anything naturally I can do to help with blood clots? I've had 2 failed IVF cycles before we found this out. Now, naturally with blood clots, no. Baby aspirin is that's a tree bark. Acupuncture can certainly help with miscarriages, but blood clots, that's pretty much allopathic medicine. It's pretty much drugs. I don't know. There are substances that can interfere with clotting, but I wouldn't know anything about those for antiphospholipid antibody. U2 enzyme I'm donating, and my wife is carrying. So reciprocal IVF. We both do the same amount of blood work? Well, I do recommend that because that gives you the option of finding out for yourselves who is the best egg provider, who is the best uterus provider. Can I start my treatment plan if my uterine lining is abnormally thick? If it's for an embryo transfer, no. It's for a retrieval, yes. How often for acupuncture again? It's 9 visits before your eggs come out, and depending if you're doing a frozen embryo transfer, it's 8 visits before you put the embryos back. You're welcome. I think I missed about the fresh versus frozen. Yeah, when you find out if you're gonna have a fresh or frozen, is on the day that you get your trigger. If your estrogen is above 3,000 or your progesterone is above 1.5. How long do you stim before IUI? Is it the same time as a retrieval? No, Michael. The stimulation is usually a couple of extra days because it's very low dose. Fresh transfer with PCOS if labs are okay. Absolutely. As long as labs are okay, your lining isn't too thick. Absolutely, Kelly. Leslie, currently COVID positive despite being vaccinated. Any effect of potentially starting a cycle this year as a result? Not that we know of right now. Just because you're positive does not mean if you're vaccinated, it means you're a temporary carrier, like we all are when the common cold comes. I had 50 eggs retrieved, fertilized 39. I have PCOS in the family. Should I get my embryos tested? How old are you? That's what I need to know. Do you perform tube cleanouts for clogged tube? No. Shandura, I am a DOR, diminished ovarian reserve patient, is low estrogen with 5 follicles normal. That's pretty darn good. How much do you lean on embryo grading? Not at all, Aaron. Not at all. When would you recommend Zyma processing? I don't recommend it. I don't disrecommend it. I don't have any opinion on it. Is frozen transfer have higher success rates than fresh? Not necessarily. Tori, there's really no reason for you to do PGTA testing. Naturally artistic. If I come to your fertility clinic for consultation, do I have to repeat required tests that I took earlier this year at another facility? Absolutely not. As long as they're current and they make sense, naturally artistic, no worries. Is there a weight limit that CNY would like you to be? No. Okay, they're talking to each other. I was told by an outside CYNRE, I don't know what that means, my ovaries are too high to be visualized on transvaginal ultrasound. What other option do I have for IVF? Well, abdominal ultrasound. Abdominal ultrasound. Elizabeth, IUI number 3, letrozole, HCG trigger, 3 follicles, labs, 7 days past IUI with estrogen of 54. Can low estrogen in luteal phase have an impact on implantation? Yes, it can. You can take estrogen. My OBGYN told me I have partially septate uterus. If I'm getting surgery to remove the septate, should I request them to look for endo as well? My consultant with you is in November, just someone Santi. Well, it depends on if you have symptoms. If you don't have symptoms, you definitely don't want somebody poking on the inside of your belly. What are the same things you can do to increase frozen? What are some things you can do to increase frozen embryo transfer success? Acupuncture, the keto diet, growth hormone, PRP washes, HCG washes of the uterus, acupuncture, yes. How many cycles after an early miscarriage do you recommend before trying for FET? How many cycles? 2. I had a chemical pregnancy in July. When should I go for the next transfer? August. Kelly, can you get IVF with 1.3 AMH? Yes, absolutely, Kelly. Kelly A. Hillier Lamb. Absolutely, you can do it. Absolutely. How do Orlistat and letrozole help with endometriosis? It starves the endometriosis of estrogen, and anything that starves endometriosis of estrogen will cause it to contract. Hi, New Beginnings. AMH went from 0.77 to 0.2, too fast. 38 years old, 4 children, no tubes. What protocol do you suggest for stims? I've done 275 and Omnitrope with 0 eggs 2 weeks ago. You know, that's either the low dose protocol, which is what you were on, sort of, or a high dose protocol. So if the low dose protocol doesn't work, you might want to try a high dose protocol. Noble Jack, HCG watch. What is the percentage it helps with implantation? There are no studies. Waiting for rainbows. 30-year-old unexplained infertility after doing all possible testing, waiting on ERA results, 3 failed embryo transfers. We transferred 2 each time. Should we try 1 embryo or continue with 2? Well, what I would do is first wait for the ERA. It depends on how many embryos you have left. Again, I don't think putting in more is better. Cycle day 2 endometrial lining is 11. Is that bad? It's not neither bad nor good. It's just thick, and it should get thinner here pretty soon, Jennifer. Ernie, after a failed fresh transfer, when should we proceed with the next? The next month. How does morphology of 2 affect things? It makes it very hard for intercourse to work. Love your company. Thank you. Currently be treating for hypothyroid, low vitamin D, and iron deficiency. Any advice? Yes. Treat. Those are critical. All 3 of those are critical for successful pregnancy. So please, yes, do that. My husband is in the U.S., but in the military. Can his semen be shipped to the CNY? Sure. The plug yacht. Hello. What's a good lining number? Anything above 6, up to 16 is fine before the transfer. And some people are saying the lining thickness doesn't matter, but I think a minimum of 6 is probably a good idea. What stage of pregnancy do you recommend getting the COVID vaccine? That's a great question. I don't have a quick answer, Josie. I'll find out, but I would go to the American College of OBGYN. Everything is laid out there. They have pamphlets for patients telling you exactly about we absolutely at CNY encourage everyone to get the COVID vaccine. Whether you're trying to get pregnant, you're breastfeeding, you are pregnant, whether your husband is going to be providing the sperm, get the COVID vaccine. Get the vaccine. It is absolutely fantastic in terms of what is going to help you, your family, your baby. Chronic endometritis, how does it affect implantation? Midnight piece, it reduces implantation because of its inflammatory nature, and so treating it, and we have what's called the antibacterial protocol, and you could talk to our doctor about that. 58 enchanted soaps. From consult, assuming all tests are already done, how long before stim day 1? Likely 6 weeks. Naturally artistic. My doctor recommended that I do a myomectomy. How long should I wait after till I try? 6 weeks. Magic number. Any recommendation about an endometriosis diet? I think a whole food diet is critical. Low processed foods, low carbohydrate foods. I think those are the keys. Thoughts of bariatric surgery before IVF pregnancy? Already had 2 failed IVF attempts. Carrie Kegler, yes. It depends on how old you are, but yes. We do know that excess weight affects implantation. It affects miscarriage rates. It affects how well you get pregnant. Doesn't mean you can't get pregnant, nor does it mean you shouldn't get pregnant. It just means it does reduce it. Oh, I love the kisses now. These kisses are getting better. Guru Girl Life. Hi, I'm 45, FSH of 17. Do I have a chance to have a healthy pregnancy? Well, there's 2 questions in that. One, a pregnancy is a low chance for a pregnancy, but it does happen. And healthy, that's based on the number of chromosomally normal embryos you make. So IVF with PGTA won't be one way, or just simply fresh IVF, mini dose protocol, day 3 transfer. Kimberly, I want twins. Can I ask for 2 to be transferred? No. You could ask for anything you want, but the recommendation is no. Because we don't try for twins, and I've said that to many times on this Instagram web thing, is that I've placed 1 embryo inside and gotten triplets, 2 embryos got octuplets. So this idea of putting in more is not a good idea. Second, if you have a twin, you have a 15% chance, 1 in 7, that those children are going to have long-term medical problems. Why would you do that? It doesn't make sense. I know you're desperate to have a baby. I understand, but the key thing is one healthy baby because you only have one uterus. Dogs have 6 uteri, 6 horns. We only have really one place to grow that embryo, and you start putting 2 and then 4 and then 6 inside there. They're robbing Peter to pay Paul. That's not good for the baby's brain development or health. Victoria, diet for PCOS. I've lost 15 pounds so far, limiting most sugars and dairy. Fantastic. Now go low carb, and you've got it down. Low carb. Don't worry about exercise, low carb. Does my husband have to have a semen analysis done? We have both kids from a previous marriage. The only issue is I had is bilateral salpingectomy. Absolutely, Amber. Men can lose sperm in a heartbeat, literally. Never make a sperm again. You could have sperm on Monday and never on Tuesday see a sperm the rest of his life. So don't assume that your husband has sperm. Please don't. Leslie, I think I answered this question about the morphology of two. Well, if it doesn't matter. Sperm morphology does not affect IVF because we do ICSI. What treatment is recommended for mild endometriosis? Well, if you have mild, you should have had it treated when they diagnosed it. You can go on Lupron therapy or a long-term birth control pill if you're trying to get pregnant, just to prepare you. You could do Oralisa and letrozole for 3 months to prepare you. All righty. Is my FSH is 20? Can I still have success this cycle, or should it be best to wait? Brooklyn, never, ever, ever wait for another cycle if your FSH is elevated or your AMH is too low. You lose anywhere between 1,000 to 10,000 eggs per month, depending on your age. Less than 35, you lose 1,000 eggs a month. Over 35, you lose 10,000. So time is against you. Lauren, I brought Dr. Kilsey's Keto Lifestyle book. Great. Do you recommend the same diet? I absolutely feel like that's a solid approach for fertility. And yeah, I mean, it's wonderfully written. It's all about fertility, so God bless you. What is the treatment process for women with premature ovarian failure? Oh, you're welcome, Brooke. Well, the one-Jojo, I love the kisses, thank you. What is the treatment process for premature ovarian? If you have no eggs, I'm not sure what ovarian failure means, no eggs. Low ovarian reserve, acupuncture, growth hormone, serovital, these are things you can do. I am 41 years old. Do you think that is too old? The plug a yacht. Everybody on this whole social media, tell her, no, of course, 41 is beautiful. Beautiful. How long does it take to have a normal miscarriage after a baby heartbeat is not found at 8 weeks? Usually can take 4 to 6 weeks to miscarry. I apologize. Can we transfer a mosaic embryo? Now, a mosaic embryo is an abnormal embryo. Let's get that straight out. But it has the potential of being mislabeled, or it has the potential of being able to create a healthy baby. Okay. How many months should I take Omnitrope prior to IVF? Well, growth hormone studies say anywhere between 12 to 18 days. We believe 30 to 60 to 90 days is a really good amount of time because that's the natural cycle of the egg. So at least 30 days if you can. Since nature knows best, why not do natural fertilization? Nature doesn't know best, or else you'd be pregnant. So I don't know what that means, nature knows best, because nature says that there should be no pregnancies after age 24. That's when fertility starts declining in humans. So if you are younger than 24, sex should work. But if you're coming for care, nature has no value in this equation. Sun Muchutin, failed IVF transfer this month and last month miscarriage with natural pregnancy. Call is not until September. So what do you suggest? I have 2 eggs currently waiting PGT testing. I don't know what that question is. Is a saline sonogram and hysteroscoping are necessary if I had a tubal ligation? Well, you need something TC Dolores or TS de la Rosa to find out if the uterus is okay. You can do what's called a hysteroscopy, which is the gold standard. Greetings from Sarasota, Amy. Pretty soon you're going to have a place there. Digi Ekan. Hi, Dr. Mag. Would you recommend an MRI therapy to treat submucosal and subserosal fibroids before transfer of a PGT embryo? Shaved it once. Oh, yeah, but it grew back. Of course it grew back, Digi. I know nothing about MRI therapy for fibroids, and I don't know if there's any studies on fertility, but I do know surgery, there's plenty of studies. Rosa Acerfia 52. My egg is not mature. What is your advice? Well, allow the stimulation to go more days if you can. The Sarasota location is opening probably the end of August for basic stuff, not for IVF. That won't probably be till next year. Can you do IUI with low morphology? Of course you can, Gabby. Lena, hello, Dr. Margaret. I had my fibroids removed. How long should I wait for transfer? About 6 weeks. Michaela, I've been told my infertility is unexplained. I saw my blood work. My levels were slightly high for PCOS. Is that why I'm on low HCG for my protocol? Yes. So that's not unexplained if you have PCOS, by the way. JJ, I'm 42 and just had my first retrieval. Only one egg made it, but it was abnormal. Should try again? Absolutely. In 20-year-olds, it takes 3 IVF cycles to achieve a pregnancy, not per transfers, 3 fresh IVF cycles to achieve a pregnancy, in the majority of women, to achieve a pregnancy. So if you're 30 years old, it should take more, 40 years old, even more. Okay. If there's unwanted fluid in my uterus found during an HSG, would IVF procedure be different? No. On my labs, my TSH was very high. What does that mean? You have hypothyroidism. You need to be treated. Could labs be normal and still have PCOS? Absolutely. J-Bell, hello. What do you recommend for unexplained fertility between IUI and IVF? Both my labs and hysteroscopy were normal. My husband also had no issues. Now I am confused on what to do at 35. Well, to be honest with you and frank with you, you should probably try 1 or 2 cycles of IUI if the sperm are truly normal. Otherwise, you might consider IVF. Shannon Dura, I have 5 follicles and on day 8 of stim. My estrogen was 78. Is that okay? Well, if you're on letrozole, it's just too little information. It's okay if things are growing, as long as the follicles are growing. Is there a cutoff age for us? No. I had 2 failed cycles in the past, 2 eggs each time, and I'm 32 planning on going back again. What is your advice, Sexy 509? Well, acupuncture, growth hormones, Serovital. You can pick that up at Costco. Avoid alcohol, tobacco, drugs, both partners. Low carb eating. Maybe slightly higher dose medications. You're very welcome. A week ago on ultrasound, I had a 5-millimeter cyst. I'm on day 5 of progesterone, estradiol, day 1 of Lupron, and now on day 1. It's like I was told to go for baselines to see how everything is. Will any of these meds right now affect the FET? Not sure what all is supposed to do. I forgot to. Okay, sorry, Marlena. Call the nurses. There's too much you don't know, and have them go over everything with you. Can my husband benefit from Serovital, Benobeljac, Nobeljack? Absolutely. Healthy body, a fertile body is for men or for sperm providers and egg providers and uterine embryo carriers. Healthy body, fertile body. What do you recommend for lowering testosterone? There's birth control pill can do it, but that's not going to help you. Metformin may do it, but really dexamethasone or a steroid may do it. Your doctor will have lots of stuff up his sleeve. So Marlena, you have to keep calling because I can't. Your question is too broad for me to tell you what Lupron. it has many functions. Okay, so again, sit with the nurses, go through every day, and I can't do it online here. It's just too complex. Oh, buying Vital on Amazon is fine, but buy it at Costco. It's much less expensive. Why is it good for some older women to have fresh transfer without? Well, the main reason we want older women to have fresh transfers is they get a transfer. Because the whole idea about frozen transfers is that it chooses the best of the best of the best. But if you don't have a lot, you might as well let your uterus do it. Chandra, I had fertility testing almost a year ago. Should I have my hormones tested? Yes. You're welcome. Agonist protocol resulted in poor fertilization using an HCG trigger. Half of my eggs fertilized. Wouldn't it make more sense to do HCG trigger again? Well, you have to be, again, sorry, HA Quattlebaum, I don't understand. How many retrievals can you do in a row? Well, in Israel, they do 17. So my second in 6 weeks, but think I should take a break after this one for a month. I'm 43. Every month you wait, Lisa, you lose 10,000 eggs. So you decide. Maritza, do you have any data on mosaic embryos that you have transferred that ended in successful pregnancy and healthy baby? Nope. What ovaries are covered in my ovary? Why are ovaries covered in cysts? I do have PCOS. Well, that is exactly what PCOS is called, is polycystic ovaries. So that's what it's supposed to be called. Is my only option weight loss? No. There's medications. There's a variety of things you can do. Lauren, my pleasure. Amber, I've heard such conflicting things. Is fresh transfer recommended? That's what I was aiming to do. Yes. There's no conflict. There's no better. I mean, there are certain women who do better with frozen, only like PCOS or hyperstim or something like that, but embryos belong in the uterus. Is it possible to stop ovulating naturally after many months of Clomid, even if ovulation was normal previously? Yes, unfortunately. Any recommendations for fibroid shrinking? I'm trying to shrink before my myomectomy. Yeah, Luke. Any recommendation to resolve an Nabothian cyst? It's usually a small surgical procedure in the office. Can acupuncture help? I'm not sure, but they can try. What dosage of Serovital? There's only one dosage, and please get the least expensive Serovital. Do not buy that advanced one. Get the basic one. The advanced one has caffeine and other stuff in it, which you don't need. What vitamins and medications I need to take to get ready for IVF? So download our family building guide on our resource page at cnyfertility.com, resources. Download our family building guide, and it has everything there. Serovital is a growth hormone secretagogue. It stimulates your own body to produce extra growth hormone. Jennifer, is it possible? What is my professional opinion is the best approach for someone to have a child who had a history of ectopic pregnancy, surgery on both IVF? Is assisted hatching done with both 3 and day 5 embryos? Yes. Is it possible to try to do IVF without the medications? Reasons I'm trying to do IVF is because I don't have fallopian tubes. Well, yes, I guess, Jennifer, but you really need to understand the way IVF works is by huge numbers of eggs growing, so because most eggs are abnormal. So you need a lot of eggs to find the one that's normal. So if you don't use medications, you're only going to make 1 egg, maybe. 41 poor quality eggs, 13 retrievals. 13 retrieved, 1 made it to blast with trisomy 21 and factor 8. Okay, don't know what that means. Okay, is melatonin safe after a frozen embryo trade waiting for beta? I'm not there's a lot of stuff about melatonin and questions about it, so I tend not to recommend it only because it's just too loosey-goosey in my way of thinking. Catrice, I don't even know what that is. Pterostulbine, true Nigene. I have no idea what that is. Am I too old to try at 47, Sunny? No. Does Colorado do urology? Yes. Color or Ado. So I like that. Colorado. What is PRP? PRP. Okay. Platelet-rich plasma. That's the platelets from your own body, have amazing growth promoting and healing properties. They use it in orthopedics, they use it in ophthalmology, they use it in many different places. And we're now using it in the ovaries to stimulate the growth of the follicles, as well as we're using it in the uterus to increase the thickness of the lining and the quality of the lining. I am transferring on Monday and have to decide to do PRP on Monday or Saturday before. What would you recommend Saturday before? Aletha, I can't wait to meet you too. And make sure, folks, when you come, and I'm looking through the waiting room, just say, hey, Dr. Magarelli, I talked to you on Facebook Live or something, because I love that. So please do that. If a transfer fails, do you recommend to try the next cycle? And do I recommend the same protocol? I recommend we just review it, have a clinician review it. Should I take DHEA? There's a great book called It Starts with the Egg, and it seems that and there's our studies which indicate that DHEA can help. Should hubby stop using different kinds of sperm boosters? I'm not sure I can answer that because I don't know what those are. Is Lupron the only option for shrinking fibroids? Nope, but talk to a gynecologist. I don't do that surgery. I don't know what the normal progesterone level for cycle day 7 is, to be honest with you, because it has no function. I've turned 50 and I'm too old for IVF. What's better, fresh or frozen eggs? Well, today pretty much you need to get frozen donor eggs. When do you recommend to use donor eggs? Well, when you don't have your own eggs. Who would be the best contact for urologists in Colorado for a biopsy? It's Dr. McBride from Urology Associates, or Dr. Cohen from Urology Associates. Thank you, Barbara S., Florida. Okay. Mena, I had an HSG in 2018. It said I have one tube and it's blocked. Do you recommend a retest? I'm 39. I recommend you do IVF as soon as possible. Should we always be PGTA testing in our 40s with such low chance of good embryos? Why would we not test? There's no reason. Why would you not test? Because your uterus is a much better place to test an embryo than a laboratory if you only have a few, because there's always a risk of the procedure. So that's the reason why you might get recommended a fresh transfer. Aunt Leah, 81. Can my husband donate sperm at a local facility in California and have it sent to you? Yes. All righty. How many IUIs do you recommend before IVF? I've done 3. Unexplained infertility. All tests are normal. Tell me how old you are, Tabitha. But I think 3 IUIs up to 6 is probably the max. Is there a correlation between grades and gender? Nope. Would you suggest a DOR patient that only has 5 eggs to do a fresh day 3? Yes, not a day 5. Davida, I had 11 eggs retrieved and only 3 fertilized on day 1. Is there any hope? Or are my eggs making it to day 3? Absolutely, Davida, absolutely. I forgot your question, Tabitha. But yeah, do 3 and then maybe 6. Oh God, Tabitha. Do 3, you've been trying for 4 years. Do 3 IUIs and then move on to IVF at 33. Why are there so much fertility issues in this world? Well, it's because women want to get pregnant after the age of 24. That's why. I mean, we're fundamentally evolved for our peak fertility is 18 to 24, and then it goes downhill from there because in caveman time, we didn't live to 30, so it made no sense for the eggs to continue. That's number 1. Number 2, we have multiple sexual partners, which of course leads to sexually transmitted diseases, which can be a cause of infertility. We have a problem with obesity, which again causes anovulation and therefore leads to infertility. Men are absolutely exposed to alcohol, tobacco, drugs, don't take their vitamins under stressful conditions, again leads to infertility. So the list goes on and on and on and on. I wish I were 24 again. I wish I was 24 again. My transfer failed on the 19th. This is Naliv. And my HCG test. My cycle started Friday. I'm coming in Friday. If they do another transfer Monday, is that too soon? What? My transfer failed the 19th. My cycle started Friday. Oh, 19th of July? That doesn't make sense to me, Naliva. Amber. Taylor, hi. Can you explain the cervical lining expectations at baseline and then at transfer? Cervical or uterine lining? You mean uterine lining. And my lining was thick at baseline and they suggested waiting and trying Provera. Yeah, you want to bleed. If you're going to do a transfer, you want to have a thin lining to start. Leslie, are there enough eggs? Can we gender select? Absolutely, but you need to do PGTA. Or vice versa, can we choose not to know gender? Absolutely. We do not tell you something you don't want to. We try not to tell you anything you don't want to hear. But yeah, make sure you tell them you don't want to know. Sammy Jing Wonderland. If Clomid had caused me to stop ovulating on my own, what can I do to start ovulating naturally again? Clomid doesn't stop you from ovulating. Can you take Serovital if you're using growth hormone? Absolutely. There's no such thing, Heather, of lowering your FSH. FSH is a gas gauge telling you how many eggs are in your ovaries. You can't, simply by breaking the gas gauge and taking the needle and going from empty to full, does not mean you have eggs in your gas tank or gas in your gas tank. So changing the FSH doesn't have any meaning in terms of fertility. What's better, day 3 or day 5? The answer is yes. I'm so excited. 11 eggs retrieved, 10 mature, 9 fertilized, 7 embryos. God dang, 41 years old. Holy mackerel. Yeah, you sure do, Krista. I had a transfer on the 6th of July. I found out the 19th that it failed. Okay. My cycle started Friday, which is a 20-something. I went in Monday, and now I'll be doing another transfer this coming Monday. I don't think that's right. I'm sorry, I just don't think that's right, Naliva. There's some timing differences there. For a day 3 fresh transfer, what would I want my uterus lining at? At least 6 millimeters, 7 millimeters, 8 millimeters. Those are all good numbers. Sarah, bam, bam, Tribble. I'm having some pain when leaning over after my transfer 5 days ago. Is that normal? It could be that you're pregnant. It could be a ligament pain, but also you should be following up on your HCG to make sure it's not an ectopic. So make sure you bring that to your doctor's attention. That's what they have me for. Well, Naliva, if you think it's, I'm just saying, Naliva, you say they. I don't have access to your records, so I can't comment as to the timing. Okay? But yeah, you can wait a month if you want to wait a month. Tweet, did beta yesterday and still waiting for the results. How that is very frustrating. Is using progesterone cream helpful? Nope. First cycle, 13 eggs retrieved and only 7 more mature. Only 7? Okay. I think that's amazing. That's normal. Simulation was 14 days. Whoever did that did a great job. JJ103. Can someone do a modified natural if they don't have tubes and therefore don't ovulate? Yes. So ideally, when you're doing a transfer, you want your lining to be trilamina before you start your progesterone. And you want it to be about 6 millimeters, 7 millimeters, 8 millimeters at the minimum. And usually there's not really a maximum, but I would imagine over 18 or 19 would be too much. But somewhere in that range, more and more data seems to suggest that it's the presence of the medications that help, not necessarily what the lining looks like. Brittany, if my first cycle failed due to no mature eggs, should I stim longer? Yes. The only difference in my next protocol is no Femara and increased gonal. Good. So, but go longer. Tell them, please look at my last cycle and see how many days I went and how mature my eggs were and the size of my follicles. Again, remember, help us by saying, hey, are my follicles 17, 18, 19, 20, 21? I thought I answered this question about Naboleon cysts, my dear. It doesn't affect the sperm getting into the uterus. 2 rounds of Femara, no ovulation, 2.5 and 5. What's next? PCOS. Consider IVF. Is CoQ10. I'll tell you what, naturally artistic. Download our family building guide. Your questions are really good, but they're very basic. Download our family building guide, and all the recommended vitamins are there to really help you get a breath of it. Every single thing can be helpful, cannot be helpful. It's just too hard to have a yes, no. But CoQ10 is an antioxidant. It can help sperm, it can help eggs, help everything. By the way, I'm Paul Magarelli. I'm in the Colorado Springs office with Dr. Don't worry about it, B Noble Jack. I came off harsh. I didn't mean to come off harsh there. It wasn't my intention there. But sometimes people ask the same question over and over and over again, and I'm not sure they're not hearing it. Okay. So yes, men should take CoQ10. Men should take folic acid. Men should take a fertility. And by the way, all of these lectures that we put together, and I've done lots of lectures on supplements, are on our CNY Fertility Facebook, pages, or we have them all cataloged. You can go on our website, and I have lots of stuff on a lot of these topics. Ziara Beard Witchet, hello from Atlanta. I'm so happy. How often do you recommend acupuncture after a treatment? After a transfer? Well, it can be weekly. And talk to your acupuncturist. I love the kisses. Thank you. Thank you, B Noble Jack. I appreciate it. Sometimes I'm answering too quickly, so thank you. Should we do our basic labs before? Yeah, if you can do your basic labs, AMH, semen analysis, HSG, CBC, thyroid panel, all of the thyroid, the anti-thyroid antibodies, hepatitis A, B, C, HIV, syphilis. Fantastic. If you can get those all done and they're current, God bless you. I think it's great. When you set your first appointment, you'll get an email explaining all you can do. Okay, yeah, Leslie, thank you. That's true. As soon as you set your appointment, boy, will you get a lot of information. And then every single week, you'll be getting information. So I've just found out this morning that that's what the team is going to do, is break down little vignettes of information to send you. So we're all about education. Can laparoscopy and hysteroscopy be done in Colorado Springs? Not in our office. Lexington. Adenomyosis, 2 failed transfers. Is it time for Depolupron? Hard to say, Lexington, because there's a lot of other factors that will affect that choice. This is Calesto. I love this. Driving home from my retrieval right now. I'm a passenger. Thank you for saying that. Remember, we want you to rest the day of the procedure and the day after. Don't go home the same day. Same thing with the transfer. Rest that day. Rest. Please give yourselves a break. Have a little vacation in Colorado Springs. Be that as it may. And you're happy with your number since they had 5 oocytes based on the ones before. So I'm glad you're happy. All recommended testing is also on the website. So guys, go to our website. We want you to be ready to go, ready to do IVF as soon as you come see us, because we can. I mean, so get all your basics done. The family building guide lists all the tests, lists all the medication, lists all the things that you can do, lists how acupuncture can help, lists how low carb keto can help, lists all the vitamins that can help. So absolutely. Brittany, is it okay to take low-dose aspirin and antihistamine regularly prior to and after an egg retrieval? Yes. 58 enchanted soaps. 10 eggs, 1 fertilized using conventional. Oh, I have no idea why you'd use conventional fertilization. Please, again, I'm a nerd. So our technology helps you achieve a pregnancy faster. If you don't use ICSI, you're only going to expect 50% to fertilize. If you do ICSI, you expect a minimum of 70% to fertilize. So, just had my first cycle. Doctor wants to move right into a second cycle, but I have non-refundable vacation in August. Is it okay to wait a month? Sure. Do the best you, I mean, they're doing it for you, but you know what? Do the best you can. I have no opinion on pineapple core. Absolutely, COVID vaccines do not affect fertility. Take the vaccine. Take the vaccine. Take your vaccine. Tell your family. I can't tell you how many, and it's disappointing to me because it just doesn't make sense of my patients haven't gotten the vaccine. It's, I know, unfortunately, the way it was presented was bad, but god dang, I think we now have what? Hundreds of millions of people who've taken the vaccine and are doing, hundreds of millions of people are doing well. Anyway, that's just my soapbox. Jennifer, first transfer ended in miscarriage with PGT testing. Found chronic endometritis. Would you keep one embryo transfer or go up to 2? It has nothing, Jennifer, those are not related concepts. Treat the endometritis and then put 1 in. When is Sarasota opening? We think the end of August. You did amazing on my egg retrieval, thank you. We had just a realistic, honest conversation about expectation. I appreciated that. I was amazed by the 10 eggs you found. We got a 5-day hatching embryo. I am so happy, Sarah. Bam, bam, Tribble. And yes, guys, I am dedicated to giving you guys honest information about what I know or don't know, and dedicated for you to make good decisions based on science. That's just my prejudice. I can't imagine how sick I'd be right now if I've gotten the vaccine. You wouldn't be? Is transfer fails, when should the period come? It should be about 2 weeks. If you hadn't gotten the vaccine. Oh, I see. Oh, okay, Leslie, I was like, I misread that. Yeah, my 92-year-old mom, of course we got her vaccinated. And as soon as we can, we're going to get our grandchildren vaccinated as soon as it's approved. This is a real thing. It's not in our minds. Sexy Jojo sent a request. I don't know why people send requests for being on the video. This doesn't work that way. Oh my God, Sharadora. I was not on letrozole this cycle. I was on gonal and menopur, and I'm a diminished ovarian reserve patient. I have 5 follicles, and on day 8 of stim, 2 of them were 12, and I have estrogen level of 78. Is that okay level? And does estrogen reflect the maturity of the eggs? Yes and no, Shandora. It looks like you're going to have to grow more. It's a function of their growth. Oh, I'm so glad, Leslie. I misunderstood. I know everything's delayed here. I asked you to request. I sent the request to be in your life. Yeah, but that's not something we do. Is there a time limit we should wait after the vaccine to transfer? Yes, 30 days. Do you recommend PGT with no known fertility issues, 30 years old? No. Yeah, no. The data now don't support that that's the right thing to do. Okay. Man, I can't believe this time has gone by so fast. Do you recommend uterine scraping? Scratching, I think is the term. No. Do all patients take ganirelix? No. My doctor doesn't believe checking progesterone levels changes anything. Do you think it would be beneficial for me to have my progesterone levels checked? If Tabitha, you're doing IVF and you're doing injectable progesterone and vaginal, then yeah, you probably don't need to have your levels checked. If you're doing vaginal only, the levels don't mean anything. Adine, I'm not going to talk about Sarasota until it opens up. So and it hasn't opened up yet. So again, it's going to be a basic monitoring initially, and then at some point it'll be a full IVF cycle, but it's still a month away. Binocle Jack. I typically ovulate on day 10. How long is someone typically on stims before retrieval? Typically, they're on at least 10 or 11 days of stim, but you should be on Citratide or Ganirelix to prevent you from ovulating. Vaccine to transfer is 30 days after second vaccine or 30 days after considered fully after the second vaccination. Yeah, IUIs, yeah, one test on progesterone is all you need. All righty, so we are at 7:26. Can anything improve egg quality when you have 2-3 weeks to retrieval? Yes. Serovital, acupuncture, growth hormone has to be put on growth hormone. Yeah, those are kind of the ones I think of. Eandre, 28. If doing an IVF traveling treatment, can I do day 1 baselines here? Yes. And then travel for the monitoring clinic? Absolutely. Hillary, you're welcome. You're welcome. Can you do a live talk about donor eggs and options? Let me get my little book out and I will add that. Donor eggs and options. Okay, guys. Maybe I'll do that next week. I have a failed FET followed with a light cycle, but very intense cramps and vaginal pressure for 3 weeks now. Well, get an ultrasound. Let's see if there's some tissue inside there, Shenandoah. Lisa, if doing 5 to 7 retrievals quickly, can we stay on Serovital? Yes, you can stay on Serovital the entire time. Could you please elaborate on PGT testing? Whom would it be beneficial for? We are unexplained with diminished ovarian reserve. No, PGT testing only tells us which embryos to transfer. It does not improve the chance for us. Well, you're welcome, Binova. It does not improve the chance of that embryo sticking nor getting pregnant. It just improves the doctor's ability to choose the right embryo to give you. It's best used for people with genetic issues. It can be helpful in women 35 to 40, but in all other ages, it's questionable based on recent data. It can help you to pick a boy or a girl. So that's when you use it. But when you have very few eggs, I'm more and more convinced that put the embryos inside the uterus because the uterus is smarter than my lab. Is it normal, Amanda, for progesterone to drop from 31 to 25 when on a shot and vaginally positive? Oh, yeah, that change is meaningless, Amanda, yes. Shronda, non-pregnant but started leaking fluid from right breast. Thyroid test was normal. Should I retest the hormones? You should test for prolactin. If the leaky fluid is milky, it might be galactorrhea. And yes, checking your thyroid was a good idea. Hi, Doc. Can you talk about the use of Zymot to improve fertilization? I don't recommend it. Sorry. Is it? Let's see. Do baselines have to be on day 3? No, they could be on day 1, 2, or 3. Is a solution to put her on birth control to delay her cycle starting? Absolutely. So I guess that's gonna be my last question. So there was a suggestion that I do a talk on donors next week, donor eggs, the process, maybe the evolution of using a donor. That sounds interesting. If there are any other suggestions, you can sort of lay them out here. Again, thank you all for being part of this wonderful experience. I will be, let's see, yeah, I will be looking forward to talking to you guys next week. This is Dr. Magarelli from CMY Fertility, Colorado. Thank you all. Kisses. Yes, I love kisses. Thank you, thank you, thank you. And I hope you guys have a fertile week. And all of those people that I'm privileged to say hi to every day, my staff, the staff at CNY Global, the call center, the nursing call center, the global travel center, the donor team, the financial team, the laboratory team. Here's a shout out to Amanda, absolutely, who came out to help us out of Albany. She's an amazing nurse. Thank you so much, Amanda. Love to you. And thank you, Dr. Kiltz, for creating one of the most fascinating and future thinking IVF centers in the globe. I've been around because I'm old. Anyway, you guys, love to all of you. Good luck to all of you. And I look forward to pregnant news. Take care, guys.